can't forget to talk about smell. What does a really bad smell mean?
Well, an imbalanced microbiome. So that's the first thing. So, bacteria in the gut, our gut is really a fermentation machine. So the more you have fermentation and the more smell you have, the more you wonder if you've got a lot of bacteria that's toxic, right? And is there an infection going on in your gut? So smell is important. Lack of change of smell usually means a balanced microbiome, especially if you don't have any symptoms or GI symptoms.
We all know that popular emoji we use. It's that soft serve ice cream styled poop pile. Is this a good representation of what our poop should look like?
No, actually, it's not. Your representation, I'm going to be a little bit graphic here, is really that log in the toilet that sinks to the bottom. If it's floating, it's not a good idea. If it's little pebbles, pencil shape, it's not a good idea. Any change, again, is not a good idea. So, no, the soft serve ice cream is not the way you want your stools to look like.
How can we make sure that we have a healthy bowel movement? What steps can we take to just make sure we're on the right track, so to speak?
Track, yeah, that's a good point. So, healthy diet is important, right? Make sure you're exercising. Make sure, I think as much as it's important for people to pay attention, they shouldn't obsess about it. In other words, don't wait to time your stools. Like it's 8 o'clock in the morning, I want to have a bowel movement. It comes when it comes. So calm down your system. Vitamin D, I'm a big pusher of that. Fiber is very important. Decrease your stress. If you're stressed, your bowels are not moving as well. You got to give it time for your system to calm down, to have regular bowel movement. And that's the most important. And also check your medications. Maybe you're on some medications that is altering. And talk to your doctor. Be present with your doctor to have that discussion. Because yes, all disease begins in the gut. And we're certainly going to be showing that with the microbiome in the future, especially with you as a psychiatrist, anxiety, etc. It's all microbiome imbalances. Yeah. So it's all GI.
You went through a lot of important signs we all should be looking for. And if, in fact, we do recognize these, we see changes, we see some of these red flags that you've just discussed, go to your doctor. It may be time for some tests, some x-rays, maybe a colonoscopy, upper GI, those good things to make that diagnosis, right?
Absolutely.
All right, Dr. Hazan, thanks so much for stopping by for Bowel Busters. Who are you going to call?
Thank you very much for having me.